This is the pulse oximetry skill. We begin this skill, as all others, with standard precautions in place. When we encounter patients that have dyspnea, shortness of breath, hypoxia, circumoral cyanosis, retractions, tachypnea, all of the things that we consider when our patient's having difficulty breathing, then we want to analyze their SpO2 using the pulse oximetry device. We're first of all going to select our patient's finger, make sure it's free of nail polish, make sure they don't have false nails on, make sure it's otherwise clean. You simply then place the device on that patient's finger. Almost all of these devices automatically turn on, and we simply wait a couple of seconds for it to have capture, and we're reading now that this patient has a 98 SpO2. If your patient has an amputation or false nails or something interferes with your ability to use the fingers, you can consider placing this on the earlobe, on a toe, or perhaps on the bridge of the patient's nose. When we identify and document that our patient does have low SpO2, then we would either supplement them with high-flow oxygen, or we could take some other measures. For example, if the SpO2 reading is less than 86, we would want to consider ventilating that patient using a bag valve mask, perhaps even consider CPAP if it's available in your area. But in any respect, you still have to do something to raise that patient's oxygenation level. If it's between, say, 86 and 90, you again might want to consider using bag valve mask to ventilate your patient, but again, at least high-flow oxygen through a non-rebreathing mask. If it's 91 through 95, then we would simply provide supplemental oxygenation through a non-rebreathing mask. If it's higher than 95, we typically would just keep an eye on our patient's airway and breathing.